Natural birth typically refers to having a vaginal birth without pain medication or routine medical interventions. Benefits of natural birth: an unmedicated approach to labor and birth may suit you if you want to remain in control of your body as much as possible, be an active participant throughout labor, and have minimal interventions during labor and birth, such as continuous fetal monitoring. If you choose to go this route, you accept the potential for pain and discomfort as part of giving birth, but with the right preparation and support, women often feel empowered and deeply satisfied by natural childbirth. Of natural birth, clinical research shows that most natural childbirth techniques are not invasive, so there's little potential for harm or side effects for you or your baby. Many women have a strong feeling or empowerment during labor and a sense of accomplishment afterward. Despite having to endure pain, many report that they will choose an unmedicated birth again the next time. For some women, being in charge helps lessen their perception of pain. There is no loss of sensation or alertness. You can move around more freely and find positions that help you stay comfortable during labor, and you will remain able to participate in the delivery process when it's time to push your baby out. Your partner can be involved in the process as you work together to manage your pain. You can use the breathing exercises, visualization, and self-hypnosis you learn both during labor and later on. Many new mothers find themselves drawing on their relaxation techniques in the early days of breastfeeding while coping with postpartum discomfort or during those times when caring for a newborn feels especially stressful. Risks of natural birth: unlike an epidural, natural pain reduction techniques don't eliminate pain. So if you are not interested in feeling and working with the pain, you will be happier with an epidural. Also, natural approaches may not offer adequate pain management, particularly if you end up with a prolonged labor or a complicated labor that requires a lot of interventions. Preparing for natural birth: once you have made up your mind to try to deliver naturally, you need to actively prepare for it. You can do this by choosing a supportive caregiver and birth environment, developing a birth plan, ensuring that you have good labor support, and educating yourself about childbirth and coping techniques. It's possible to have a drug-free delivery in a traditional hospital setting, but for many women, it's easier to labor naturally in an alternative setting, such as a birth center or at home. Birth centers are designed to prove a natural, family-centered experience, and you can certainly arrange things as you like at home. You are planning a natural childbirth in a traditional hospital setting. You will want to discuss your wishes and goals explicitly with your caregiver. Find out which interventions are considered routine at the hospital and how you might get around them. Certain interventions, such as having an IV and continuous electronic monitoring, make it difficult to move around. Having to stay put like that tends to make it harder to handle labor pain without medication. Note that the American College of Obstetricians and Gynecologists recommends that women with low-risk pregnancies have the option of intermittent monitoring and frequent labor position changes. Many women choose a midwife to guide them through natural childbirth. Midwives are trained to help you cope with the demands of medication-free labor and often stay with you throughout labor, which doctors typically do not. If you are giving birth in a hospital, you will be assigned a labor and delivery nurse to care for you. Some nurses are very skilled in natural coping techniques, but you can't predict which nurse you are going to get. Nurses come and go in shifts, and the nurse may have other patients to care for as well. If your practitioner won't be by your side for the duration of your labor, hiring a doula to stay with you and coach you may be particularly valuable. Find a childbirth educator with a strong focus on natural childbirth to teach you a variety of coping methods and help you understand what to expect during labor. Understanding what's happening during each stage can allow you to appreciate and work with your body. Whether or not you plan to have a natural delivery, it's a good idea to learn as much as you can ahead of time about both natural and medical pain management. Tension and fear tend to heighten the perception of pain, and anything you can do to ease your anxiety will help with the challenges ahead. Being less anxious may even help the progress of your labor because high levels of stress hormones can affect your uterus's ability to contract. Also, if you are planning a natural birth, it is important to remember that no matter how well prepared, healthy, or confident you are, it's always possible that nature will throw you a curveball. You might need medical interventions that make it more difficult to manage your pain naturally, or your labor may be much longer or more painful than you had anticipated.